Hi, I'm Dawn, otherwise known as that Mom of Four. I'm here at Halley Medical Aesthetics to see Dr. Terence Tan. Hopefully you can help me out with a few issues that I've been concerned about ever since hitting the big 4-0 and beyond. So some of the things that I've been worried about include the fine lines and the dry skin around my eyes, as well as the texture of my skin. Not as plump as it used to, so let's see what it can help me out with. Hi, Dr. Tan again.
Hello, hi. Welcome back again.
Yeah, it's a pleasure being back here. Thank you so much for the consultation the last time.
Oh yeah, you're welcome, Dawn. Yeah, always happy to see you. Yeah, so I'm Dr. Terence Tan from Halley Medical Aesthetics, and today you're here because you have several concerns, right?
Yes.
And what are they?
Okay, so well, after hitting the age of 40, I think everything just has gone downhill a lot faster. So the lines around my eyes in particular are something that bother me. So I'm a bit hesitant, and part of my job requires me to be very expressive in what I do. So every time I smile, every time I make a face, lines start to appear everywhere. Yeah, so most obvious is around my eyes and around my face as well, the laugh lines.
Okay.
Yeah, so apart from that, I also have very high cheekbones.
Okay.
And this has never been a worry. In fact, it's been a very good thing in the past.
So.
But you know, part of aging has caused you know, certain features to be a little less desirable. So yeah, the sinking in of my cheeks is something I'm worried about as well.
Okay. And I think the last time when we met, there was something that you were also a little bit worried about. You were also worried that whatever treatments that we do might be unnatural, might be just a little bit too much. So I think it's quite, I mean, it's a very common concern. So on one hand, we want something to be good enough such that we look better, but at the same time, we want something to be well, not too much such that you know, we look too different. So I think this is something that we deal with day in, day out. So I do have one recommendation for you. So maybe we might want to consider treatment with Sculptra. Okay, so Sculptra is you can call it a kind of filler, but I think in the end it doesn't really work like a filler. Okay, so as we get a little bit older, there are certain areas of our face that we lose we lose volume. And when we lose volume, that's why all these wrinkles start appearing. And when we lose volume around our cheekbone area, as you can see here, when we lose some volume around our cheekbone area, it kind of makes the cheekbone look a little bit bigger. And also we lose some volume over our smile lines or our nasolabial lines, and our marionette lines over here. Yeah,
I actually feel like I'm turning into Maleficent sometimes.
I don't think so, but certainly I think there are some things that we can do to help make it look a little bit better. So I think the first thing we are talking about is the wrinkles around the eyes. So I think for the wrinkles around the eyes, it is due to a few different reasons. So number one is you're a very nice person, so you tend to smile a lot. And these are very strong muscles that we have around our eyes. And no matter how young we are, if we were to smile strongly, these muscles will form small little creases there. So one thing that we might want to consider is really to do a little bit of treatment to relax those muscles around the eyes, around the eye area, such that when we smile, the muscle over here is not so tight and it doesn't come out so much. So those are good for what we call dynamic lines, which are lines which appear due to movement, and in this case, smiling, laughing, and other facial expressions. So I think that's good. And another way to really help with some of the wrinkles that we have around the eyes is to volumize around the eyes, because over the years we've kind of lost a little bit of skin elasticity, and we also lose a little bit of volume around our eyes.
Is it because of muscle tone? Or?
It's because of bone loss of certain fat over the superficial areas, and a lot of different reasons. Loose skin. So while when we do fillers, we are actually just revolumizing around the eyes, so that the skin quality is not so loose. So where we will propose, can you hold this for me? I think number one, you can see over here, you kind of lost a little bit of volume over here, and it looks a bit sunken in. So number one, we want to fill up the temple area, and this is actually called our mid face, and a little bit over on the outside of your tear trough. And when we do slight volumization there, I think the results would be good as well. So that's number one, which is your wrinkles around your eyes. Number two, you also complain, or rather you also say that you have got big cheekbones.
It is a complaint.
So there are a few things. So if you have a big cheekbone, one of those things that we can do is to fill around the cheekbones over where you have lost some volume.
Yeah.
So you have lost some volume over here, behind,
Yep.
over your cheeks, and a tiny bit just over here called your mid-face.
Okay.
What we'll do is we want to reform the OG curve, okay? Don't worry what the OG curve is, it's really not that important. But now, what we mean is that when we have got a nice curvature over the cheekbone and the cheek area,
Yep.
without some of these depressions around it, then we have got a nice unbroken curve,
Yep.
which looks a little bit more like how you and I look like when we were a little bit younger.
Sure.
Yeah. So when we have a little bit of a better OG curve, because your cheekbones then becomes a bit less prominent as compared to the slightly depressed areas around the cheekbones, it would look slightly smaller.
Okay.
Yeah.
Okay. And so is this all done in one treatment?
Yeah. Well, not really. So Sculptra is actually a collagen stimulator, and therefore it really isn't a filler as you and I would think of as a filler. Okay, so it's very natural. We would reconstitute this, so it comes in a powder. So we reconstitute this. It's just a medication. There's really no physical filling effect with Sculptra.
Okay.
So it's a medication that we apply underneath that skin, and with a blunt needle called cannula, and the Sculptra is actually a medication that stimulates your body's natural collagen. But not for tightening, but more for volumization and lifting.
Okay.
So it's very good for areas whereby we lack volume, like the cheeks, the mid-face, the temples, the nasolabial lines or the smile lines, and the marionette lines. And it's very natural because of two things. Number one is it doesn't fill. It makes your body fill those areas with collagen.
Yeah.
Yes, it does take some time. And number two, it does take some time because one time is not enough. In general, we do repeat treatments every 6 weeks to 2 months.
Okay.
And we need about 3 treatments for sufficient volumization.
I see. Okay.
Well, of course, not everybody is the same. Some people 2, some people 4. But by and large, about 3 treatments. And then each time, we actually volumize a little bit more. Okay, so what's the good point about Sculptra? Number one is really, really natural. So for certain areas whereby we want to make sure that we get a nice natural volumization, like say the forehead, maybe the under eye area, or the cheekbone area, I think this gives a really nice but gradual and slow improvement.
That's good.
Yeah, and thereafter it actually lasts a really long time. Based on most studies, it lasts between 2 to 3 years. But based on my personal experience and based on some of the studies I've read, it should last you for about 3 years or so.
Wow.
Yeah, so it's a really long-lasting filler.
Okay.
And lastly, it is your own collagen that's causing the volumization.
So less chance of any side effects.
That's right. Yeah. So less chance of any side effects, and because it is your own collagen, people like the fact that it's their own collagen, which is having volumization. So, so I think there are various advantages to this.
Yep.
But it's not for people who need to have volumization really, really fast. Okay. So it takes a long time for your own collagen to come out because there's no filling properties, and therefore, let's say if you have got a big event coming up in 2 weeks' time, I think other fillers might be a better idea.
Because you won't be able to hit that timeline.
No, probably not. Yeah.
Okay.
So once you put the Sculptra in, you have volumization, but mainly due to the water that contains the Sculptra, and after a few days, it will actually go away, only to slowly increase through the weeks and months.
Okay.
Yeah. So it's that's the disadvantage of Sculptra, but it is a really, really good filler, or it's a really good collagen stimulator for volumization, and I think this is probably my #1 recommendation for you. Why is it also safe? It's actually because it's US FDA approved.
Oh, great.
Yeah, so a lot of evidence has gone into its safety and its effectiveness. Yeah. Initially, before it was actually used for beauty, for cosmetic purposes, it was actually used for medical conditions.
Such as?
Well, some medical conditions give rise to what you call lipoatrophy, which means reduction in the fat over the cheek area. And Sculptra was initially used for these patients who had sunken in cheeks due to medical conditions to re-volumize the cheeks so as to make them look better.
Wow.
Yeah, because socially it's very important, as well as medically, to treat these people with these medical conditions.
Okay.
But of course, with good results for these patients, then there's good safety data. FDA approval also extended for people who just want to look better
and
anti-aging.
Yay, okay.
Yeah. So, and it's also quite safe. We'll use a blunt needle for that. A blunt
Is it
needle
similar to what is used like for TCM? It's blunt needles, right? So there's no bleeding, is it?
TCM actually uses sharp needles, but it's similar to what we use for fillers, which is a cannula or magic needle. So, so it's blunt, so the chance of bruising is a little bit lower, and we don't have to, well, it's a little bit more atraumatic, and it's generally speaking a better procedure with less side effects.
Okay.
Yeah, so we definitely use that for you.
Yay! Alright, so I'm not going to frighten people when I leave.
I don't think so.
Okay.
Yeah. But then again, you also take some time.
Okay.
Yeah. So if you have no further questions, I'll get my staff to put some numbing cream for you.
Yep.
And then maybe we'll start in about 15 minutes time.
Sounds good. Thank you, Dr. Tan.
Alright, you're welcome. We're going to start. This is all that we need, so I've just placed them all in front of us. This is a Sculptra. It comes like a powder.
Yep.
Obviously, it's not going to be very effective as a powder. So we have to reconstitute it. Okay. So what we do is we put some water, and then after that, it becomes something like this.
Ooh, okay.
So it takes many hours for it to dissolve properly. So we can't just dissolve it and use it, or reconstitute it and use it. We have to do it beforehand. Okay. So today we are using up to 2 bottles of Sculptra. And we also need certain other things. So we are going to use a magic needle or cannula. So this is very important because cannulas reduce the chance of bruising and they are generally a safer treatment method. Yeah.
Awesome.
And so what we're going to do is we're going to do some planning. So as with every single treatment, the most important part of the treatment is not the treatment itself, but how we plan for the treatment.
Okay.
Okay. All right. So I'm just going to use just a normal skin pencil to do a bit of drawing.
Okay.
Now, let's plan it together. Head against the table. Yeah. Okay. So the first thing that we're concerned about is the area here.
Yep.
Yeah, which is our temples. Okay, and we are also concerned a little bit about over here, a little bit of tear trough out here.
Yep.
And a bit of the mid-face for volumization over here. So that's what we're going to do.
Yep.
And you can see our cheekbones are here. So we are just put a little bit underneath the cheekbones here. And a little bit underneath the cheekbones here. And you're also concerned with your smile lines or your nasal labial lines and your marionette lines here. So this is where we're going to put some filler. Yeah?
Bingo, all the problem spots.
Yeah, so that's what we're going to do. And hopefully with this treatment, we're going to get a nice rejuvenation, which should give you the results that you want.
Yay!
So this is what we're going to do, and we're going to make sure that we are precise in the amount of Sculptra that we use. Yeah. So there's something that we need you to do after the treatment, okay?
Yes.
So I want you to remember 5-5-5. So over these areas, after the treatment, I want you to massage it 5 minutes, 5 times a day, for 5 days. Okay? Do you know why?
To help with the spreading of the...
That's right, yeah. So you've read up about it, right? So what you're doing, when you do that, you're actually helping reduce the chance that there's too much collagen over one area, because the body has a mind of its own, right? It doesn't, it sometimes produces a little bit more collagen here, a bit less collagen there. So, so we must make sure that we are very nice and even. And number 2 is mechanical stimulation should improve the amount of collagen that is stimulated, even without having
anything
too
else
much,
added in.
too much of the stuff added in.
Okay.
So that's what we're going to do. We are going to prepare and we're going to start very soon.
Okay.
Yeah. I want to take a picture so that we can remember where he had done the treatment.
Okay.
Okay, so now we're going to start. Okay, so we've got 4 syringes. We've pre-drawn them from the Sculptra bottles. And we're going to use 2 for your right and 2 for your left.
Okay.
Okay, alright, let's start. So we're using the magic needle. And we're going to do that.
It's very fine.
Yeah, it is. Let's start with your temples. I'm going to turn your head a little bit. And then eyes you. As you prepare. Okay, you have a look. Yeah. So this is where we have filled up. It's just full of water over here.
Yep.
And here, so it's compared here and here, it's very different. Yeah, and we smell a little bit.
Yep.
Smell? Smell. It should be a little bit less.
Yeah.
So it looks nice. Yeah.
Yeah.
So we'll carry on. Let's go on the
I
under
can
eye
see the
area.
difference.
Have a look again. Yeah, you can see. So relax a little bit. Yeah. Okay, so you can see we put a little bit around here to give it a bit of lift, and a bit at the side here, so that your lines get a little bit better. Of course, we first put water. Then it doesn't look as nice and smooth.
Yeah.
Give it some time, it will kind of even up nicely.
So generally, how long does the water take to like?
Maybe about 2 days or so.
Ooh,
Yeah,
okay.
2 days. So 2 days will look nicer, but then after that, you'll be back to normal again.
Okay. Okay.
Alright, let's go for your smile lines and your marionette lines.
Okay.
And a tiny bit here.
Yep.
So it looks nice, smoother.
Oh, I can actually see it. Yeah, it's more filled out now.
Yeah. Now let's go on to this area and this area now. Look straight. Yeah. So it looks like it's
Little
a bit
plumper.
small, plumper, but that's not. It will go away quite nicely.
Okay.
So I think the main area that we actually put on was actually over here. So a bit lifted here, and this part will tighten up quite nicely later on.
Okay.
Okay. I think I want to put a bit more over here, but I think I'll go the other side first.
Okay.
Yeah. And so the temples, you can see.
Yep.
And then the under eye area is nice.
Yeah.
It's still a little bit lumpy at the moment. You just massage it a bit.
Yeah, so it does feel like there's a bit of pressure on the eyes.
Yeah,
right?
it's normal because it's very it's very numb. Yeah.
Okay.
And then the cheeks now look almost perfect.
Yep.
Yeah.
Fuller.
Look at your cheekbones on the left and right. Which one looks bigger?
This one more obvious.
Yeah. Right.
Yeah.
So.
Yes, it's smoother. Yeah.
yeah.
So would you say the end result, like at the end of the entire 3 sessions, that it will look more like how it is right now?
Yeah. I think that's a good estimation.
Okay. Okay. So how many ml went into this one area?
Between 1 to 2.
Ooh,
Yeah.
okay.
Between 1 to 2. So some of the water has gone away from this side already, so it doesn't look as nice. So this one looks comparatively better.
Yeah.
Than over here and here. Yeah. Okay, so it's very nice here. It's very nice here. So just finish off with here and here.
Okay.
And we'll call it a day.
Yay, that was fast.
Almost there. Yeah. Now, I want to show you something. Now, this thing here is what I use. So it's called a cannula or magic needle. So it's one. See?
Whoa.
So it's safe when we put it near your eyes, and it doesn't hurt even my finger.
Wow.
So it's going to be safe when you do it around your eyes.
Okay.
Okay.
Cool.
Okay, so we have finished already.
Yeah.
And now we need to teach you how to massage.
Okay.
So massaging is the most important.
Okay.
Right? Because you want to make sure that the collagen is stimulated evenly.
Yep.
Because the body sometimes produces certain collagen more over certain places.
Yep.
And also very important that the more you irritate the skin through massage, the more collagen is going to be produced. Okay.
Ooh, so you can go beyond 5 days.
No problem. Yes. That's actually what I wanted to say.
Okay.
So some people also recommend doing it a little bit more. But to be practical about it, I think 5 is a lot of commitment already. So anything more is an extra. Okay?
Okay.
Now let's do it together and don't close your eyes. Yeah. So the first area we want is your temples. Okay. So and just light massage will do. Yeah. Remember where we had drawn. So all the way to near your crow's feet area. Okay, so that's number 1. And number 2, we'll do it over your mid face, and also on the outside of your tear trough, all the way inside here.
So it's a pressing action.
Just pressing and just a little bit of round massage action is good. Yeah.
Okay.
And then lastly, or rather not lastly, thirdly, over here, and over here, over here. Remember all the way up here, all the way down here, and here. Right? So just circular movements with firm pressure. Don't worry about spreading of the medication, right, or the Sculptra. It's already in.
Okay.
So there's not a problem. Yeah?
Okay.
It won't move. So the other thing we'll do is we'll do it the other side. Same. Remember where we put the Sculptra? Over these areas. Don't worry if it looks a little bit asymmetrical right now, because it contains water, and once the water goes in, it kind of spreads all over the place. But the Sculptra remains over the same place. Okay, so same. Remember all those areas that we have put Sculptra in, especially near this area. And then here, 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 and here. A bit over the other side as well.
Will it matter what topical cream I use?
It doesn't matter, because you see these tiny little holes that we made. It goes close up really, really fast, and it's really not a big issue with makeup. But perhaps maybe for the immediate hour after, if we can avoid putting makeup over the small little holes that we had made, it will be better.
Alright.
So temporarily you look fantastic. Okay, so this is an idea of how you look like after the complete treatment. But of course, for now, it's really just a bit of water, and that really will go away after about as we have said, 1 to 2 days.
Hours.
So so that's good. Don't forget, 5, 5, 5.
Okay.
Okay. All right. So we see you in about 6 weeks' time.
Okay. Thank you so much,
Take
Dr.
care.
Tan.
Bye bye.
I've just come up from the treatment room with Dr. Terence Tan here at Halley Medical Aesthetics to do the Sculptra treatment. Earlier on, I mentioned about the areas that I was concerned about, specifically my marionette lines around my mouth, the fine lines here as well, under my tear trough, the sides of my eyes, the very fine lines, as well as my temples. So very heartening of Dr. Terence Tan to be able to address all these areas and do the treatment in those areas as well. It was actually not uncomfortable at all. I was able to continue talking throughout the whole process, but there's something that I need to do for the next 5 days. Very important, 5 days right after the treatment is to do a massage for 5 minutes, 5 times a day. So 5, 5, 5. And this will continue to help stimulate the collagen production to where the treatment was done. So yeah, stay tuned for when I come back here again in 6 weeks' time, and we'll see what happens.